This is JAPI, and welcome to JAPI Podcasts.
In partnership with Torrent Pharma, by the makers of Nebicard and Telsar Biso, where science meets care.
Hello. Welcome to the JAPI Podcast to the March 2026 JAPI Volume number 74, Issue number 3. I am Dr. Shrikanth Hegde. This issue of JAPI has some really interesting articles, which includes 15 original articles, 3 review articles, and 1 therapeutic spotlight, and 1 letters of correspondence. Let's discuss these articles in detail. The first original article is titled Atherogenic Indices in Newly Diagnosed Obese and Lean Patients of Type 2 Diabetes Mellitus, a Comparative Study by Almeida et al. In this study, treatment-naive newly diagnosed patients of T2DM were recruited and grouped into either obese with BMI more than 25 and lean with BMI less than 18.5. Various atherogenic indices were estimated, including LDL cholesterol to HDL cholesterol ratio, non-HDL cholesterol, total cholesterol to HDL cholesterol ratio, atherogenic coefficient, and lipoprotein combined index, and they were found to be higher in the obese group than in the lean group. Notably, these calculated indices were above the recommended cutoffs in both the obese and lean patients with T2DM. This study is the first to document increased atherogenic risk in both obese and lean patients with newly diagnosed type 2 diabetes. Although the CVD risk is higher among obese patients, aggressive control of plasma lipids is required in all patients with T2DM, irrespective of BMI. The next article is on distinct risk profile in posterior versus anterior circulation strokes, a prospective study from Western India by Kirtan et al. This prospective observational study was conducted at a tertiary care hospital, including patients with confirmed anterior or posterior circulation strokes. Among 376 stroke patients analyzed, 274 had ACS and 102 had PCS. PCS patients were significantly younger with higher prevalence of modifiable risk factors like hypertension, current smoking, metabolic syndrome, and poor glycemic control status. Despite lower NIHSS scores, brainstem infarcts in PCS accounted for most in-hospital deaths. Multivariate analysis identified hypertension, smoking, age less than 55 years, and metabolic syndrome as independent predictors of posterior circulation stroke. The authors call for territory-specific risk stratification and more targeted screening for younger Indian adults. The next article is on alterations in serum electrolytes among adults with enteric fever, a retrospective observational study from a tertiary center in New Delhi by Shubham Mishra et al. The prevalence of pattern of serum electrolyte alteration in adult patients hospitalized with enteric fever were studied in this article. Hyponatremia was present in 58.6% of the patients, while 57.8% had low bicarbonate level, consistent with a trend towards metabolic acidosis. In contrast, potassium and chloride values are predominantly normal, with abnormalities occurring in less than 10% of the patients. The study underscores the importance of routine electrolyte monitoring at admission in patients with enteric fever so as to guide early correction and prevent complications. We move on to the next article, which is an interesting article from rural Rajasthan. E-health initiatives for screening and management of anemia in rural Rajasthan by Shweta Mangal et al. This is a prospective cohort study conducted in 2 villages near Jaipur with difficult access and inadequate health services. A population of around 3,800 individuals aged between 6 months or older were included in the study. An Android application was used on tablets to identify anemia after hemoglobin estimation through the hemoglobin color scale. The objective was to assess the anemia prevalence and the effect of anemia after follow-up at 5 months and after 9 months after giving iron folic acid supplementation, along with deworming among children and dietary guidance and health education through pop-up videos in an e-health application. The overall prevalence of anemia significantly declined from 46.08% at baseline to 14.65% at the 9th month. Males had a higher prevalence of anemia than females. An overall improvement of 68.2% was observed in anemia status, with the greatest improvement seen in the 1 to 5 year age group and among females. Mean hemoglobin levels showed a consistent increase across all age groups, with the maximum being in the 6 months to 1 year age group and among females. This study demonstrated that community-based, sustained and targeted strategies through the use of e-health initiatives can effectively combat anemia and achieve significant improvement in hemoglobin levels across all age and gender groups, even in resource-limited settings. The next study is entitled A Prospective 1-Year Study of Renal Recovery in Pigment Nephropathy Insights Beyond the Acute Phase by Prem Shankar Patel et al. In this study, 20 patients with biopsy-proven pigment nephropathy were analyzed. The mean age was 27.75 years, with the average peak serum creatinine was 12.09 milligram per deciliter. Rhabdomyolysis was identified in 14 patients and hemolysis in 6 patients. 85% of the patients required hemodialysis, and all 20 patients survived and achieved complete renal recovery. None of the patients followed for a year progressed to chronic kidney disease. The authors conclude that while the initial presentation can be severe, the prognosis is highly favorable with timely supportive care. The next study is on clinico-mycological profile and in vitro antifungal activity of terbinafine and griseofulvin against clinical isolates of dermatophytes in a tertiary care hospital by Jaisma Rajni et al. A total of 118 samples were studied from patients with clinical suspicion of dermatophytosis in this study. Tinea corporis appeared as a leading symptomatology in the study, followed by Tinea cruris. Trichophyton mentagrophytes was the predominant species with 85% isolated, followed by Trichophyton violaceum in 10% of the cases. Terbinafine resistance was observed in over 60% of the isolates of Trichophyton mentagrophytes isolates, with moderate resistance detected in Trichophyton violaceum group. Griseofulvin showed a moderate resistance in mentagrophytes and higher resistance in violaceum. The study highlights the increased resistance of terbinafine, and the researchers stress that routine antifungal susceptibility testing is no longer optional. It is essential to guide the effective therapy and combat the growing threat of treatment failure, especially in fungal infections. The next study is titled Association Between Androgenic Hair Patterns and Prostate Cancer Risk in South Indian Men, a case control study from the Kaveri Delta by Jayaprakash Narayan et al. Previous Western studies have suggested that early onset baldness might be a marker for prostate cancer risk in men. In this case control study, the researchers examined the association between androgenic hypertrichosis, androgenic alopecia, and prostate cancer in Dravidian men from the Kaveri. The cases consisted of 117 men with pathologically confirmed adenocarcinoma of the prostate and 123 controls and prostatic hyperplasia from the same hospital. The prevalence of androgenic hypertrichosis and alopecia did not differ significantly between the prostate cancer cases and the BPH controls. These findings contrast with the data from the Western cohort, suggesting that the interethnic variation in androgen receptor polymorphism, follicular sensitivity, and environmental exposure in Indian population may modulate the prostate cancer risk differently than in the Western cohorts. The next article is on implications of acetylated status and therapeutic drug monitoring in plasma rifampicin and isoniazid concentrations among Indians by Prem R. Arora et al. Low or abnormal plasma concentration of anti-tuberculosis drugs can be a major reason for treatment failure or the emergence of drug resistance. Acetylated status, which affects the drug metabolism, plays a key role in determining the drug bioavailability. Plasma concentrations of rifampicin and INH were measured using the in-house standardized HPLC methods, while acetylated status was determined by a conventional PCR of the Na2 gene. Peak concentrations were estimated from 125 patients on first-line tuberculosis treatment. Among these, 56% exhibited subtherapeutic rifampicin concentration and 28% had subtherapeutic INH concentration. Conversely, Above normal concentrations were observed in rifampicin and INH, 2% and 21% respectively. Despite receiving the standard TB treatment regimen, only 62% of the patient improved clinically, while 38% of the patient continued harboring TB signs and symptoms, among which 6 patients developed rifampicin resistance during the treatment course. Acetylator status significantly influenced the plasma concentrations of both the drugs. Slow acetylators had significantly higher INH concentration and lower rifampicin concentration as compared to the rapid acetylators. The study concludes that acetylator status influences the plasma concentration of rifampicin and INH. Hence, determining the acetylator status and the use of therapeutic drug monitoring ensures the patients are receiving effective doses, thereby preventing the emergence of multi-drug resistant strains. The next study is titled Clinicopathological Spectrum and Biomarker Profile of Male Breast Cancer, a retrospective study from a tertiary care center in South India by Sanjana Reddy Potu et al. In this study, a total of 15 patients with male breast cancer were identified. Median delay from symptom onset to diagnosis was 6 months. Most patients had advanced disease either in stage 3 in 60% and stage 4 in 26.7%. Invasive ductal carcinoma was universal. Hormone receptor positivity was seen in 80%, HER2 positivity was seen in 40%, and triple positive phenotype in 26.7%. The authors advocate for policies that include male-specific breast cancer protocols and emphasize that earlier detection is critical for improving the survival rates in men with breast cancer. The next original article is titled Hospital Hyperglycemia is Associated with Adverse Short-Term Metabolic and Mortality Outcomes by Apuru Oja et al. In this study, which is a descriptive follow-up study which was conducted in 50 patients with hospital hyperglycemia. Half of the hospital hyperglycemia patients are diabetic, although 26% of the patients with hospital hyperglycemia were unaware of their diabetes status. The hospital hyperglycemia in diabetics as well as in pre-diabetic subjects is associated with a higher age and BMI compared to normoglycemic individuals. Hospital hyperglycemia in pre-diabetic subjects is associated with higher mortality and greater propensity to develop diabetes in the short term compared to normoglycemic individuals. The next original article is a study on prevalence of malarial retinopathy among malaria cases and to determine its presence as a marker of severe malaria. Observation from Eastern India by Rupak Chatterjee et al. A total of 71 malaria cases were included in this study. Among them, 12 cases were of severe malaria and the rest were cases of uncomplicated malaria. Of the 12 severe malaria cases, 8 were Plasmodium vivax, 3 were Plasmodium falciparum, and 1 was mixed. Features suggestive of malarial retinopathy were 12 cases of severe malaria and 2 of 59 cases of uncomplicated malaria. The presence of retinopathy was suggestive of severe malaria. The authors found that the sensitivity and specificity of malarial retinopathy as a marker of severe malaria are 75% and 96.6% respectively, with a positive predictive value of 81.8%. Malarial retinopathy may serve as an important clinical biomarker for predicting severe malaria. The next original article is on early LDLC lowering effect of high-intensity atorvastatin and ezetimibe combination compared with high-intensity atorvastatin alone in acute coronary syndrome, the LAI early ACS study by Vimal Mehta et al. In this investigator-initiated trial, 254 patients admitted with ACS were randomized 1:1 to receive either atorvastatin 80 mg once daily or a combination of atorvastatin 80 mg and ezetimibe 10 mg once daily. The primary and secondary endpoints are the percentage reduction in direct LDLC measurements at 4 weeks and 12 weeks respectively. The investigators found that ezetimibe added to the high-intensity statin therapy was well tolerated and resulted in an immediate and robust additional decrease in circulating LDLC concentrations, with a markedly higher proportion of participants achieving LDLC goals at the end of 4 weeks and 8 weeks. These promising results show that the dual therapy initiated immediately at ACS diagnosis has the potential to improve the cardiovascular outcomes. The next study is titled The Prevalence and Predictors of Neurocognitive Impairment, Fatigue and Health-Related Quality of Life in Patients with HIV or AIDS by Arpita Raj et al. This study involved 100 people living with HIV, with 48% being females. 47 patients had neurocognitive impairment, male gender, PLHIV with less than 5 years of treatment, and age less than 50 years had higher scores. In India, the prevalence of neurocognitive impairment, fatigue, and decreased quality of life is higher compared to other populations. The study calls for a more proactive social support system and the integration of neurocognitive and psychosocial screening into the routine HIV care in India to manage the patients as a whole. The next original article is titled Study of Thyroid Function in Newly Diagnosed Human Immunodeficiency Virus Patients with the Effect of Antiretroviral Therapy on Thyroid Function by Satyam Kumar et al. This prospective observational study included 100 newly diagnosed HIV patients aged more than 18 years. Baseline thyroid function tests and CD4 were measured prior to and at 3 months after the start of ART. At baseline, 62% of the patients were euthyroid, while the remaining 38% showed thyroid dysfunction. Following 3 months of ART, the prevalence of thyroid dysfunction increased. Euthyroid patients decreased to 41%, and the cases of subclinical hypothyroidism, clinical hypothyroidism, and subclinical hyperthyroidism rose noticeably. The study establishes that ART is associated with significant changes in thyroid hormone profiles, particularly an increase in TSH and a decline in free T3 levels, reflecting the emerging thyroid dysfunction. The results underscore the importance of regular thyroid function monitoring in HIV patients, particularly after initiating ART, to facilitate early detection and management. The last original article in this issue is on diabetic retinopathy. Does 12 weeks of intensive lifestyle intervention cause any improvement? Study by Priyal Meghsham Talmale et al. Modification in the dietary pattern, regular exercise, healthy sleep schedule, and stress management led to a measurable reduction in retinal thickening and improved neural visual function. While the changes were mild, the study proved that these interventions can reduce the severity of diabetic retinopathy. The researchers conclude that lifestyle medicine should be the first line of defense in managing diabetes and its microvascular complications. The next article is a review article titled Thyrotropin Controversy in Subclinical Thyroid Disorders by Rajesh Agarwal. The timing of TFT, whether fasting, postprandial, or random, remains a debated issue. This review suggests to avoid rushing to treat elevated TSH levels between 4 and 10 or low TSH levels between 0.5 to 1 without confirming the diagnosis with additional thyroid tests and TPO. TSH alone should not be a sole decision maker, and we have to consider other TFTs and sequential testings from the same laboratory and at the same time to make more informed decision. While TSH levels can be affected by time and prandial state, FT3 and FT4 levels remain stable, suggesting all three TFTs may aid in accurate diagnosis and treatment decisions. The next review article is on Happy Heart Syndrome, a review of Takotsubo cardiomyopathy triggered by positive emotional stresses by Rahul Garg. Takotsubo cardiomyopathy or broken heart syndrome is a condition characterized by transient left ventricular dysfunction, typically triggered by intense emotional or physical stress. While initially thought to follow primarily negative life events such as grief or fear, a subset of cases now recognized as happy heart syndrome occur instead after positive emotional triggers such as celebrations, romantic moments, or good news. These patients had higher prevalence in men and typical mid-ventricular ballooning patterns. Several key outstanding questions are highlighted, including understanding susceptibility factors, confirming the prognostic differences are discussed in this review. The last review article in this issue is on the essential role of bedside training in undergraduate medical education, which is a systematic review by Christopher Matthew et al. This systematic review examined the role of bedside teaching in undergraduate medical education, focusing on its impact on clinical competence and professional growth. The review included 15 studies that investigated the effects of BSD on physical examination skills, diagnostic abilities, communication skills, and confidence among medical students. The results showed that BSD significantly improved physical examination skills, diagnostic abilities, and communication skills and increased the students' confidence. However, the review highlighted several challenges in implementing BSD, including the time constraints and a lack of trained faculty. The review recommended integrated BSD into the medical curriculum, providing faculty development programs and utilizing technology-enhanced learning tools. We conclude with a therapeutic spotlight on semaglutide by Sunil Gupta et al. This review highlights that semaglutide offers more than just blood glucose control. It provides robust weight loss and significant protection for the heart and kidneys. With generic versions expected soon in India, the authors see this molecule as a beacon of hope for reversing the grim cardiometabolic trends currently facing the country. And that concludes our summary of the March 2026 issue. We hope these insights are valuable to your clinical practice. Thank you for listening to JAPI Podcasts.